Hey everyone, yeah, my project is about the patient sent to the electronic health record, EHR, decentralized application for the healthcare using the blockchain technology. So my today is a shift. So just a little bit of introduction. So electric um, electronic health record is like a digital version of the patient's health record, and it can be accessed and shared by the doctor to know about the patient's health conditions and to make the informed decisions on for the personalized treatment. And for the traditional EHR system, it is decentralized, and the patient has this like limited access to their health record and less control, limited controls over who can just access their health record. I would just propose like a patient-centric decentralized EHR applications to solve the limitations for the traditional centralized EHR system. So this is the literature review I review. So just to give a, and then just based on my literature review, so the New Zealand EHR system is a centralized EHR system under the ERA program. So it's aimed to just facilitate the data interoperability and data sharing among the different healthcare stakeholders, like hospital and just like the clinics. So the better data interoperability and sharing in this centralized EHR systems brings the patient's privacy concerns as the patient just lack of control over who can just access their health records. And the blockchain just like can be a technology just used to deal with this privacy concerns. Yeah, and then it's like there's some study in the literature just about the patient-centric EHR systems. Use the blockchain technology aim to just improve empower the patients to control over just and just access to their health record. And it's like my promise statement. So more and more countries just empower the patients just like to control over their health record. And there's like several studies show that majority of the patients just prefer to control their like control the access to their health records. And um, based on the like the principle in the Health Information Privacy Code 22 in New Zealand. So the centralized EHR health systems brings like the privacy consent could just like violate some of the principle in this regulation. So such as the access to the health informations like the patient should just receive based on that principle. The patient should just receive the request uh, to access to their health information and also the retentions to the of the informations, the house informations in this principle. So it's like um, the healthcare provider should just like just to keep the health information no longer than the necessary to fulfill the purpose for which the house information is legally used. And then just the privacy concern, this privacy concern may also violate the Maori data sovereignty principle, as the Maori people has a right to just control who can just access to their house information. So I would just propose like the two research questions. The first is how does the empowering the patient to control their health record, how to protect their privacy. First, that only authorize the doctor with the patient permissions can access to the patient health record. So this prevent the doctor from using the patient's health record for the other purpose than adding and viewing the health records. So the second one is about how can the blockchain technology can be used to improve the patient control over their health data in the New Zealand EHR system. So first, the decentralization features of blockchains can be used to store the health record in a decentralized ways without the centralized intermediary and also the related in the administrative cost. And then just like the blockchain just empower the patient control. So empower the patient to control over their health record rather than the health record controlled by the healthcare provider like hospital in the then the blockchain can just bring the transparency to the patient. So the patient just can view all the accepted history to their health records. And also, I also use the MetaMask along with the blockchain for the access control. The MetaMask can just be used for the user authentications to authorize the doctors and control the access to the health record. So my methodology is a mixed method. It's the qualitative literature review, the permanent EHR, healthcare system, and the blockchain systems, and then the patient-centric several studies about patient-centric EHR supply applications, and also just develop my proposed applications. So just a little bit introduction for my application features. So first is about user registration. So the user can just restrict and log in as the doctor, so the patient rules, and then it's about the EHR access control. The patients can grant and revoke access to their health record to the doctors. This health record mentioned only the authorized doctor can just edit the health record for the patients. Finally, the health record visibility and sharing. So patients can view the health records edited by the doctors, and only the authorized doctor can view the patient's health records, including the health record edited by the other doctors. So just like the key technology I use for my application, so the React for the front-end development, Solidity for deploying and test the smart contract, the Truffle is like the development framework for the ECMs used for like deploying testing smart contract. And natural is like a data to so simulate the blockchain environment for the smart contract and the MetaMask that I mentioned before, like for user authentication and the transaction management. The Visual Studio is like the code editor I use for code my project. So and just like this couple screenshot for my applications, just like a home page, and you can see there's like a register and the login. So when you click the register, you can just like register as either the patients or doctors by inputting the name, age, and genders. Then as you just log in as a patient, you will be show a patient dashboard. So it will show your personal information. And in the second section, just like sharing you EHRs to doctors, you can just like share you health records to the authorized doctors. So once the patient just grants the grants the doctors to access their health records, they can see the name of doctors and the public keys of doctors, and then just if they just want to just revoke access right, they can just click that button to revoke the doctor to access their health record. And if the user just log in as a doctor, it will be shown the doctor dashboard. So and you can see they can see the personal information, their personal informations. If the patient is granted their the access to their health record, they can see that. And when they just click the view the record, so they can just like edit the health record by inputting diagnosis and informations details to just add the health record for the patients. So then just like patient can just see all the doctor all the health records that's the doctor leave to them. And then once the doctor just like and the doctor can once the doctor just granted the access to the patient's health record, they can see the others the health record is added by the other doctors. So just like the data sharing among the different doctors. So just a bit conclusion, just like compares my proposed solution to the current healthcare system in terms of two aspects of the patient's empowerment and the time to access the health records. So first is like the patient empowerment in terms of like the current healthcare system in Zealand. So patients have limited control who can access to their health record, and the patient probably need to request for accessing their health record. They need to make a request to the doctors, and then just like there's some limitations on the transparency on who can just access to their health record. But compared to the current healthcare system in New Zealand, so my proposed solution is like enable the patient to have the full controls over who can access to their health record, and then they can just run it and revoke access to their health record to the healthcare provider, as I mentioned before, just like my application features. And this is a transparent for the patient to view all the health record access history. So in terms of time to access to health records, since the patient probably need to just make a request to access to the health record, so it makes it take a relatively longer time for the doctor, the healthcare provider to just handle the patient's access request. But for my proposed solutions, the doctor can have a near instant access to the patient health record. So after the patient's running permissions to the doctors. Yeah, that's my presentation. I need like the demo, like that's all. Okay, yeah.